We're talking today about GYN cancers, and with us today are Dr. Mildred Rigdway and Dr. James Moore. Thank you for joining us today. Just in general, we want to talk about the kinds of GYN cancers and the treatments available for GYN cancer. So, Dr. Rigdway, let's start with you. Let's just talk in general. What is GYN oncology?
Well, that's a good question because a lot of people don't really know what a GYN oncologist is. We are a subspecialty under the broader category of obstetrics and gynecology. Every GYN oncologist is an obstetrician gynecologist first, which requires a 4-year residency. The subspecialty fellowship is either 3 to 4 years, depending on where you do your fellowship. So it's a total of 7 years training. And the fellowship is spent mainly doing care regarding GYN cancers, meaning cancers of the uterus, ovary, cervix, any type of cancer in the GYN tract. And our fellowship training is very intensive in surgery and chemotherapy.
Okay, great. All right, well, Dr. Moore, then, if a woman has a GYN cancer, what is the benefit to her of seeing someone in your subspecialty for her care?
Well, on a number of different levels, I think there are benefits to women with gynecologic cancer seeing a GYN oncologist. On one level, GYN oncologists, we're trained to really handle everything for a woman with cancer. We manage their chemotherapy, we do the surgery, we help manage the radiation, we take care of complications, and really we're sort of the quarterback for a woman with GYN cancer. But on a different level, there's good scientific data that women that do have GYN cancers have a higher survival rate and a lower complication rate if they're managed primarily by a gynecologic oncologist. And so I think our training plays a big role in that in helping us to take care of women with cancer.
Okay, great. Well then, Dr. Rigdway, let's talk about the different types of GYN cancers. You kind of mentioned that in brief, but talk a little bit about what the types of GYN cancers are.
GYN cancers encompass any cancer of the GYN tract. The most common cancer in the United States of the GYN tract is uterine cancer. So there's uterine cancer, ovarian cancer, fallopian tube cancer, cervical cancer, vaginal cancer, cancer of the vulva, which is the outside of the female genitalia, and gestational trophoblastic disease is another category of GYN cancers that's a little bit hard to understand, but it's also part of what we do. And any other disease of the GYN tract that's more complicated.
All right, so Dr. Moore, the uterine cancer is the most common of the GYN cancers. Talk about just the treatment for uterine cancer then.
Sure. Uterine cancer is by far and away the most common cancer that we see, and it's usually a disease of women that are a little bit older, they've been through menopause and they've not had any bleeding for a number of years, and then they begin to have some bleeding or spotting. And because that symptom is a very troubling symptom, they usually present to their local physician. The diagnosis is made with a biopsy or a D&C, and then they're triaged to a GYN oncologist for care. Usually with uterine cancer, it's confined to the uterus. It hasn't spread outside of the uterus at the time of diagnosis, and the standard treatment is what most people think of as a complete hysterectomy, where the uterus and the ovaries and the fallopian tubes are removed. But being a cancer operation, in addition to that, we take some of the lymph nodes out from the pelvis to see if there's been any microscopic spread to any of the lymph nodes. And a lot of times that requires open surgery, but there's a lot of times where Dr. Rigdway was able to do that with robotic surgery.
I'll come to you, Dr. Rigdway, with this. What types of treatments or types of cancers might involve chemotherapy and radiation, perhaps in addition to surgery or in place of surgery?
Any cancer could need chemotherapy or radiation depending on the histology type, meaning the type of cell it is in the beginning, and how far it's spread. So uterine cancer, although it's often early stage and can be treated with hysterectomy alone, there are some times where if there's lymph node involvement or it's had some other spread, other therapies are indicated like radiation or chemotherapy. Ovarian cancer is a little bit different. It is a lot more common for ovarian cancer to need chemotherapy because of the pattern of spread it has. So most patients who undergo a surgery for ovarian cancer will need chemotherapy as well. And of course we manage that in our office.
Well, Dr. Moore mentioned robotic surgery, and I understand that's an area you have some expertise. So talk to us then about procedures with the Da Vinci robot.
Okay. The robot basically is a sophisticated computer tool that helps laparoscopic surgery. So if anybody's heard of having a laparoscopic gallbladder taken out, it's similar technology in that you don't have to have a large incision, it's just several small incisions. But the Da Vinci robot adds a little extra expertise in that it's controlled by a computer, so you have better dexterity, meaning you have better movement of the instruments, and you have better visibility. And there have been studies to show that there's added benefits to the patients, including decreased pain management, decreased blood loss, and better specimen counts.
And your training and experience in that, I understand, is extensive.
Well, I was one of the lucky ones. I got trained when it was FDA approved in 2005, and that was when I was still in my fellowship in North Carolina. So I came to Mississippi having already had the training, and I started using the system here, and at this point I've done several hundred cases, and I feel very comfortable with the technology, and I think it's a wonderful tool for women, for any patient.
Well, Dr. Moore, I want to come back to you then, talking about the advances in technology, but certainly technology is not the only advancements we've seen in the care of patients with GYN cancers. What advancements have you seen in your practice?
Well, a lot's changed in 10 years, and I think probably one of the biggest advances that we've seen in the last couple of years is in the whole field of genetic testing. And that, you know, with ovarian cancer and breast cancer, about 10% of those women have a genetic predisposition to a cancer like that. And now we have the capacity to do with a simple blood test to check for mutations in that gene that might put a woman at risk down the road for developing breast cancer or ovary cancer. And that's not only important for the woman with cancer, but it's really important for her daughters and her sons and her granddaughters. And I think that's been a real change, a paradigm shift, if you will, in sort of the preventive medicine end of GYN oncology.
That's a great answer, and that's great information for people. Gets back to the hopefulness of cancer treatment. Dr. Rigdway, you've talked about the technology. Would you say that might be the most impressive advancement you've seen in your career?
I think so. I mean, I think physicians that have been in surgery for longer than I have, for many decades, that having this Da Vinci robotic tool is a very impressive instrument. And so for me, yes, it's definitely one of the best advances.
Okay, well, this is great information, and we thank you so much for helping us today and helping us understand about GYN cancers and the treatments that are available. Thank you so much.